Yes. So this is observational study, basically looking at the data from 2007 to 2012 of CKD patients, all the stage from stage 3 to end-stage renal disease, to see if the inpatient mortality changed depending on gender. We wanted to see gender, premenopausal and postmenopausal had some effect in female, and also depending on ethnicity. So there's a follow-up on different type of patients depending on the ethnicity. So what we did was we collect the information from the national survey. Basically, was like 2 million people that were in the survey, and then after that, the exclusion criteria and all of that, we got to 211,000 and something patients that were enrolled in our analysis. What we found was very interesting, that the males compared with females in the premenopausal stage, the inpatient mortality when they have CKD, stage 3 to end-stage renal disease, is increased in males compared to premenopausal. But in females, postmenopausal females, and they were end-stage renal disease or CKD stage 5, they increase compared to males. So it's different. What you see in premenopausal, that always males have more inpatient mortality. Postmenopausal, for some reason, and that's why there is a new research that is ongoing to see why, for some reason, postmenopausal females have more inpatient mortality than males when in stage 5, CKD or stage renal disease, and we couldn't get the different. So I know that CKD stage 5 translate to end-stage renal disease is the same, but in this database, they have CKD stage 5 as the GFR less than 15, not on dialysis, compared with end-stage renal disease that is CKD stage 5 on dialysis. So that's why we make the difference. There was not direct correlation between CKD stage 5 and end-stage renal disease. I think it's more a biological marker that we are not aware yet. The other thing that we found is that there's definitely probably that will apply to underserved population or minorities. For example, we saw a difference in end-stage renal disease inpatient mortality for Latino, Asian, and African Americans. So there is a great inpatient mortality compared to white Caucasian. And probably the reason is because they are not dialyzed continuously, or they are underinsured, and they are not aware a lot of the disease. One of the things is that follow the data just in the postmenopausal and see if there was any difference in the inpatient setting, if there was more admissions to the hospital, and that's why they were having more events, or if another thing will be physiological, if the estrogen protection is not anymore on them, and that increased the risk of something to do with end-stage renal disease and the hypertension. Without the estrogen protection, you have more problem of heart disease. So probably that can be, but up to now, this is just an observational study of a big data analysis, so we cannot make any conclusion on why. We can have a correlationship that postmenopausal females has more inpatient mortality than males. Good. But we cannot know why. There's not an association yet.